Salivary gland cancer is a relatively rare form of cancer that develops in the salivary glands, which are responsible for producing saliva to aid in digestion and keep the mouth moist. These cancers can occur in various parts of the head and neck, and they often present unique challenges in terms of diagnosis and treatment. This article provides insights into salivary gland cancer, including its characteristics, treatment options, prognosis, ongoing research, and available resources. What is salivary gland cancer? Salivary gland cancer, also known as salivary gland carcinoma, is a malignancy that originates in the salivary glands. The salivary glands are found throughout the oral cavity and neck and are responsible for producing saliva, which contains enzymes that aid in digestion and help maintain oral health. While there are many types of salivary glands, cancer most commonly develops in the major salivary glands, such as the parotid, submandibular, and sublingual glands. Standard of care treatments for salivary gland cancer. The treatment of salivary gland cancer depends on various factors, including the type and stage of the cancer, its location, and the patient's overall health. The following are some standard treatment options for salivary gland cancer. Surgery. Surgical removal of the tumor is a common treatment approach. Depending on the tumor's location, this may involve partial or complete removal of the salivary gland and surrounding tissues. Radiation therapy. Radiation therapy may be used before or after surgery to target and destroy cancer cells. It is often used when surgery alone cannot completely remove the cancer or when cancer has spread to nearby lymph nodes. Chemotherapy. Chemotherapy, which uses drugs to kill cancer cells, is less commonly used for salivary gland cancer but may be employed in certain cases, particularly for more advanced or aggressive forms of the disease. Targeted therapy. Targeted therapies are medications that specifically target cancer cells and may be used when standard treatments are ineffective. They can include drugs like cetuximab, Erbitux, for some types of salivary gland cancer. Reconstruction. After surgery to remove the tumor, reconstruction of the affected area may be necessary to restore function and appearance. This can involve plastic surgery techniques. Prognosis for salivary gland cancer. The prognosis for salivary gland cancer varies widely depending on several factors, including the tumor type, stage at diagnosis, and the success of treatment. Here are some general insights into the prognosis for salivary gland cancer. Stage 1. Salivary gland cancer. When detected at an early stage and treated promptly, the prognosis for stage I salivary gland cancer is relatively favorable. The 5-year survival rate for localized salivary gland cancer can be over 90%. Stage 4. Salivary gland cancer, advanced stage salivary gland cancer, which has spread to distant organs or structures, has a poorer prognosis. The 5-year survival rate for stage 4 cancer can range from 20% to 40% or lower, depending on factors such as the type and aggressiveness of the cancer. Promising therapeutics and ongoing research into salivary gland cancer is ongoing, with a focus on improving treatment options and outcomes. Some areas of promising research include immunotherapy. Immunotherapy drugs, such as checkpoint inhibitors, are being investigated for their potential in treating salivary gland cancer. These medications help the immune system recognize and attack cancer cells. Targeted therapies. Researchers are identifying specific genetic mutations and abnormalities in salivary gland cancer cells. Targeted therapies that can inhibit these molecular pathways are under development. Precision medicine. Advances in genomic profiling allow for more personalized treatment plans based on the genetic characteristics of the tumor. This approach can help tailor treatments to the specific subtype of salivary gland cancer. One website to research clinical trials for salivary cancer is onclive.com. A variety of promising integrative treatments against salivary cancer are described in Cancer Self-Defense 101, Quick Tips to Help You Survive. Why is salivary gland cancer tricky? Salivary gland cancer presents several challenges. Diverse tumor types. Salivary gland cancer includes a wide range of tumor types, each with distinct characteristics and behaviors. This diversity makes diagnosis and treatment complex. Complex anatomy. The salivary glands are located in intricate anatomical regions with critical structures like facial nerves. Surgery must be carefully planned to minimize damage to these structures. Late diagnosis. Salivary gland cancer is often diagnosed at an advanced stage due to its relatively subtle symptoms. Early detection is essential for better outcomes. Rare nature. Salivary gland cancer is considered rare, and fewer resources and research are devoted to it compared to more common cancers. Risk factors for developing salivary gland cancer. While the exact cause of salivary gland cancer is not always clear, some risk factors and associations have been identified. Radiation exposure. Prior exposure to ionizing radiation, such as radiation therapy for head and neck cancers, may increase the risk. Age. Salivary gland cancer is more common in older adults, with the risk increasing with age. Gender. Some types of salivary gland cancer have a higher incidence in men than women. Certain medical conditions like Sjogren's syndrome and human immunodeficiency virus, HIV infection, may be associated with a slightly increased risk. Organizations and resources for salivary gland cancer patients and families dealing with salivary gland cancer can benefit from the support and information provided by various organizations, including Salivary Gland Cancer Foundation. This foundation offers resources, support, and information about salivary gland cancer. Cancer Support Community. This organization offers support groups, educational resources, and counseling services for cancer patients and their families. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.